Welcome to an introduction to the aseptic framework, a comprehensive approach to mental status examination. The Mental Status Examination, or MSE, is a crucial tool in mental health assessment. Aseptic is an acronym where each letter represents a crucial component of the examination. Appearance and behavior assessment involves observing the patient's physical presentation, grooming, and motor activity. Speech evaluation focuses on the patient's communication patterns, including rate, volume, and clarity. Emotion assessment examines the patient's mood, affect, and emotional expression. Perceptions component evaluates the patient's sensory experiences and reality testing. Thought assessment examines the organization and content of the patient's thinking process. Insight and judgment evaluates the patient's understanding of their condition and decision-making capacity. Cognition assessment examines mental functions like memory, attention, and orientation. These components work together in an interconnected way, providing a comprehensive view of the patient's mental status. The aseptic framework ensures clinical objectivity through standardized assessment methods. This structured approach provides a foundation for comprehensive mental health assessment. In conducting a mental status examination, we focus on three key observable components: appearance, speech, and emotion. When assessing appearance, observe and document specific aspects of the patient's presentation. Documentation should be objective and specific, avoiding subjective interpretations. Speech assessment involves careful observation of multiple components, including rate, volume, tone, and clarity. Different speech patterns can provide important clinical information. Here are examples of normal, fast, and slow speech patterns. Emotional assessment involves observing both expressed and reported feelings, noting any discrepancies between the two. Observe facial expressions and affect, which can range from flat to fully animated. Check for congruence between reported mood and observed affect. Document specific examples of matching or mismatching presentations. When assessing perceptions, we examine 5 main sensory domains. For each type of perception, we need to document specific details about frequency, intensity, and impact on daily life. When assessing perceptions, we use specific questions to explore the patient's experiences. We then evaluate their thought process, paying attention to how they express and connect their ideas. Special attention is paid to potential delusions and how firmly these beliefs are held. Thought patterns can be linear, tangential, or circumstantial. Each pattern provides important clinical information. There are several types of delusions, each with distinct characteristics that need to be carefully documented. In assessing insight, judgment, and cognition, we examine 3 key components. We use standardized questions to evaluate each area while maintaining therapeutic rapport. Cognitive function assessment involves multiple interconnected domains. The patient's insight and cognitive abilities significantly impact both treatment engagement and daily functioning. The aseptic framework components work together to create a comprehensive clinical picture. Each component connects and influences the others, creating a dynamic assessment process. Clinical documentation must be clear, objective, and support diagnostic formulation. Pattern analysis reveals important relationships between different aspects of mental status. These observations directly inform treatment planning and intervention strategies. Regular monitoring and reassessment help track progress over time. Remember, effective integration of all aseptic components leads to better patient care and outcomes.